So ending TB requires a very coordinated whole of government approach. And through this integrated approach, we are tackling the root causes of TB while ensuring that services are accessible, they're equitable, and they're very responsive to the needs of all Kenyans. With 63% of the notified TB cases occurring among men, targeted gender-responsive approach are needed to improve their health-seeking behavior, and again to ensure that timely diagnosis and treatment is done. We aim to deliver services to men through the workplace TB programs, sporting and entertainment events, social places such as football events, and community gatherings, providing routine screening, health education, and care linkage. And I'm very happy to report that and thank the University of Nairobi, represented here by the Deputy Vice Chancellor, that you have given us an opportunity to engage with the young people. Many of them, over 300, have gone through the screening, and we are very happy that football events, entertainments, where more of our young people are found is where we shall also focus. But not just to commemorate World TB Day, but we are here to reaffirm our resolve to end TB closes as a public health threat. The theme, yes, we can end TB, led by government, driven by community, is fully aligned with our national health agenda. Ending TB is a government-led, coordinated, result-driven mission that requires every sector and every level of government and every community to play its role. TB closes remains one of the most persistent health and development challenges facing our country. In 2025, 90,900 were diagnosed and initiated on treatment, representing 81% of the estimated burden. This gap represents life missed, families affected, and ongoing transmission within our communities. As a government, we commit to close this gap. Kenya has made commendable progress, achieving a 45% reduction in TB incidents and a 58% reduction in TB-related deaths since 2015. This reflects sustained government investment, strong county collaborations, and effective partnership. But we must now move faster, more cohesively, and greater accountability. The Ministry of Health, working with county governments and partners, have scaled up TB services across all our 47 counties. We have strengthened our diagnostic capacity by deploying the molecular test and the ultra-portable AI-enabled digital X-ray machines, enabling early and accurate detection even in some of the most remote parts of our country. And this is how we have operationalized universal health coverage, by taking service to the people. Ladies and gentlemen, ending TB will not be achieved through medical intervention alone. TB is driven by poverty, TB is driven by overcrowding, malnutrition, and environmental exposure. And our response must therefore be very comprehensive. Ending TB requires a coordinated, a whole of government response that addresses both the medical and the social drivers of the disease. We as government are strengthening efforts across sectors to improve the living conditions, enhance nutrition, promote safe and healthy environment, and expand access to screening and care in high-risk settings and workplace. And I want to ask the leadership of Nairobi County. They must take the health sector very seriously. I don't know why. I've never seen the CEC for Nairobi County in any of the health functions done in Nairobi. Neither the deputy governor or the governor. And I want to say it here, Nairobi is one of the leading counties in TB closes. Nairobi, Mombasa, Meru, Tharaka Nithi, Migori, Kakamega, Kisumu, Kiambu, Homa Bay. These are the counties that we have mapped out with the partners. And this changes every month and every quarterly. But we really want, because health is devolved, we really want our counties to take the lead. Communities are at the center of this response. Community health promoters, civil society, our faith leaders, and TB survivors are essential in finding missing cases, reducing stigma, and supporting treatment adherence. So together we must all confront stigma directly. No one should delay seeking care due to fear or discrimination. TB is curable and services are available across the country. And with our partners, including the US government framework cooperation we have signed, and many, many other partners, and with our own domestic funding, and with the assurance of the chairman, and I have written to the National Treasury, that vaccinations, TB, malaria resources shall not be victims of supplementary estimates, that they must be ring-fenced, and the Minister for National Treasury, the Honorable John Bandi, has agreed that with me. So ending TB is not just a health priority, but a national development imperative. It's about protecting households from expensive cost, sustaining a productive workforce, and advancing universal health. But I want to reaffirm the full commitment of the ministry and the government of Kenya to this agenda. As the government leads, we will collaborate with the communities. No one will be left behind in the fight against TB, because ending TB requires all of us. Yes, we can end TB, led by government, driven by community. I thank you all, and may God bless you.